Good morning, students. Today we will continue with the revision of histology slides. So, previous class we revised identification of vascular system, that is arteries and veins. In the arteries we have seen large artery and medium size artery, or elastic artery or muscular artery, and small vein and the large vein. Now we will see the lymphoid tissue. So in lymphoid tissue, how to identify this lymphoid tissue? So if you remember your previous classes of lymphoid tissue, so there are two types of lymphoid organs. So one are the primary lymphoid organs, and then the other are the secondary lymphoid organs. So primary and secondary lymphoid organs. So in the primary lymphoid organs, so these are the, so according to their formation, so and then the production of the lymphocytes. So these are the thymus and then the bone marrow. So these are the primary lymphoid structures, and then these cells, when they are produced, B lymphocytes and the T lymphocytes. So these lymphocytes will settle in the thymus, and then they will be differentiated into the thymic dependent lymphocytes. They are differentiated in the thymus, so they are called the T lymphocytes. And then after that, these will be settled in the other lymphoid structures. So those are called the secondary lymphoid organs. So these are lymphnode, palatine, tonsil, spleen, and all other lymphoid structures. So this is one thing, and the other one is structurally based on the structure of the lymphoid structures. So we differentiate these into solid lymphoid structures and the diffuse lymphoid structures. So solid lymphoid structure means solid. So solid lymphoid structures these are covered by a capsule, and then so the lymphocytes, these will be formed in the form of the lymphoid follicles, and these will have covered by the mucous membrane. Not only the mucous membrane, the other surface is covered by the capsule. So these are called the solid lymphoid structures. So in this we see the lymph node, thymus, spleen, and then the tonsils. So the tonsils comes under the diffuse lymphoid structure, and the other one is the diffuse lymphoid structures. Diffuse means, so there will be, these are not formed so it's difficult to draw with the mouse. Okay, so diffuse lymphoid structures. So diffuse lymphoid structures means these are otherwise called the mucosa associated lymphoid structures. Mucosa associated lymphoid tissue, MALT. So these are the mucosa associated lymphoid tissue means these lymphoid aggregations, the lymphoid follicles aggregations are present beneath the mucous membrane of the GIT and the respiratory system, or sometimes you may see the lymphoid aggregations in the reproductive organs also. So these are called the uterus, and then the cervical canal or the vaginal mucosa. So depending on if there are any solid, so these are small lymphoid aggregations that we may see, but not in the uterus. Most commonly we see them in the vagina, so beneath the mucous membrane. Sometimes you may see the lymphoid aggregations, these are called the mucosa associated lymphoid tissue. So in this mucosa associated lymphoid tissue, primarily we have two types of mucosa associated lymphoid tissue. One is the bald, other is the galled. Bald and galled. So bald means bronchi associated lymphoid tissue, galled means gut associated lymphoid tissue. So this bald, so you see here in the bronchi. So when you have seen the lung tissue, in that bronchi, beneath the bronchi, so we see the solitary lymphoid follicles, aggregation of lymphoid tissue as a lymphoid follicle. So this type of tissue we call it as the bald. And then the other is the galled, gut associated lymphoid tissue. So gut associated lymphoid tissue we see in the region of the oropharyngeal region. In the nasopharynx as the nasal tonsil, nasopharyngeal tonsil, also called the adenoids, when it is get infected and enlarged. And then palatine tonsils, tubal tonsil. So these are all examples for the mucosa associated lymphoid tissue in the oronasal pharynx. So these are called the Waldeyr's ring. And then we see solid lymphoid follicles in the stomach, duodenum, jejunum, and ileum. We see the Peyer's patches, ileum and appendix beneath the mucous membrane. So the lamina propria or in the submucosa, you see the aggregation of lymphoid follicles. They are called the Peyer's patches for the ileum. And also in the appendix, circularly you see that throughout the appendix, so you see the lymphoid aggregations in the submucosa extending into the lamina propria. Then you see the large intestine. So large intestine also you see the aggregation of lymphoid tissue. So these are all comes under the gut associated lymphoid follicles. So we are not discussing most of the gut associated lymphoid follicles in this class. We are discussing the primary lymphoid structures. Here is the thymus, and then in the secondary lymphoid organs we have the lymph nodes, and then the spleen. And example for mucosa associated lymphoid tissue is the palatine tonsil. So how to differentiate these four slides? So these are all have shared the similar structures, but whenever I see students writing in the examination, you are confused to differentiate these structures. Basically, that is the cortex and medulla. So in these structures, so the structures which are having the terminology cortex and medulla are the lymph node and thymus. So thymus and lymph node. So we have these two structures. We have the terminology called cortex and medulla. Okay, cortex and medulla. But if you see the spleen, we have the terminology in this, that is red pulp and white pulp. Red pulp and white pulp. And for palatine tonsil, we don't have this kind of terminology, neither the cortex medulla nor the red pulp and white pulp. So when you write the structure itself, so you need to remember the basics of how to write these structures, how to differentiate and identify these four slides that you have for the examination purpose. So I am just discussing these histology revision class especially for the examination purpose, not for the theory purpose, because so that you can read from the books and from your previous classes, right? How to differentiate the lymph node, palatine tonsil, thymus and the spleen. Lymph node has the structure cortex and medulla. It is covered by the capsule, and then thymus is also covered by the capsule. It is also having the cortex and medulla. But how to differentiate these two structures? So here lymph node has the typical lymphoid follicle appearance. You have number of lymphoid follicles, but in the thymus you don't see the lymphoid follicles. Terminology may be similar. They share the capsule. They have the capsule. They are covered by the capsule. They are examples for the solid lymphoid tissue. And they have cortex and medulla, but the structure is totally different. You can easily identify these two slides to differentiate between these two slides. That is, the lymph node will have the lymphoid follicles, but thymus you don't see any lymphoid follicles. That's the major difference. But rest of these three slides, lymph node, palatine tonsil and the spleen, these three structures have the lymphoid follicles. So when you see the lymphoid follicles in this given slide, you can easily rule out the thymus, right? So when you see a lymphoid tissue, you can rule out thymus by seeing at the slide. when you identify a lymphoid follicle. So that is, so once you see the lymphoid follicles in the given slide, you should think of 3 slides in the general histology: lymph node, palatine, tonsil and spleen. So when you see the lymphoid follicles, you can see, you can think about the other 2 slides, that is the ileum and also the appendix. But appendix comes under the large intestine, it has a different structure, and the ileum is also having the villi and all, that is a different structure. You can easily identify, no confusion to get with the general histology slides. They are the systemic histology slides, and this GIT comes under GIT. These are the general histology slides, right? So when you see in the general histology slides, a given slide, the lymphoid follicles, you should think of 3 slides: lymph node, palatine, tonsil and spleen. Now I will explain you how to differentiate these 3 slides. You can totally rule out the thymus because it is not having the lymphoid follicles. Clear? Now, so we see the lymph node slide. This is the photograph of the examination slides of yours. So lymph node is having the cortex and medulla. So this is the cortex and this is the medulla, right? So how to identify the lymph node slide? It is having a capsule. This is the capsule of the lymph node. Capsule, anywhere you see the capsule, how to identify the capsule? It will consist of the collagen fibers. So it is made up of the collagen fibers, and you see some blood vessels, and in the capsule the lymph node, periphery of the lymph node will receive the afferent vessels, afferent lymphatic vessels. So from all the places the lymph afferents, it will receive multiple afferents, and these afferents will pass through the capsule, and these will reach, the afferents will reach the medulla here. So you see the beneath this capsule, you see little clear space filled with the lymphatic fluid. It is called the subcapsular sinus. So you see capsule, then the subcapsular sinus, and from the capsule you see number of septa which are extending into the lymph node here. So these are called the trabeculae. So these septations which are going from the capsule inside the parenchyma of the lymph node are called the trabeculae. Along this trabeculae also you see the subcapsular sinus going along with, extending along with the trabeculae. It is the trabecular sinus. Subcapsular sinus, then the trabecular sinus. You have the connective tissue covering the lymph node is called the capsule, and then extending from the capsule you see the trabeculae. These are nothing but the connective tissue septa which are extending into the lymph node cortex. And then in the cortex, what do you see here? So in the cortex you see the lymphatic nodules or the follicles. So this is the typical structure of a lymphatic follicle, lymphoid follicle or nodule. So here the structure of the lymphoid nodule is, how to identify the lymphocytes here. These are bluish. So cytoplasm you may not see in the low power, and these are filled. So these blue structures which you are seeing, which are stained with the hematoxylin, are the nuclei of the lymphocytes. So these lymphocytes will be arranged in the form of compactly arranged, and these will be in the follicles. So the center of this lymphoid follicle will be pale, and you see the B lymphocytes, and these will be sparsely distributed, and these are little pale stained. But the periphery of this lymphoid follicle, you see the compactly arranged lymphocytes. These are mostly the T lymphocytes here, and these are densely packed and with the dense nucleus. So that is the periphery of the lymphoid follicle. So most of the times what you do in the drawing the histology slide, you just put dots like this. Don't put dots. So these are the, you need to draw the nuclei of this. So they are not the dots, they are the rounded structures. So you need to draw with the hematoxylin pencil. So that is the structure of the lymphoid follicle. So you see multiple lymphoid follicles in the periphery of the lymph node here. It is called the cortex. So in the cortex, beneath the capsule you see the subcapsular sinus, and beneath that you see number of lymphoid follicle with the pale central region. This is also called the germinal center. Though the name is misnomer, we call it as the germinal center. And then surrounding these lymphoid follicles, in between you see the lymphocytes here, compactly diffusely placed lymphocytes here. So this is all comes under the cortex. Sometimes you may see the follicles, sometimes you may not see the follicles. When it is exposed to infections, then you see number of follicles. But if it is not exposed to any infection or anything, you don't see the formation of the follicle. You can just see that here. This is an example for here. You can see the aggregation of the lymphocytes, but there is no germinal center here. Here is another follicle without germinal center. You may not find always the germinal center in the lymphoid follicle. Sometimes you may, if it is exposed to infections, then only you see the formation of the germinal center. Then coming to the medulla of the lymph node, you see here in the medulla you see number of sinuses. These pinkish structures are all the sinuses. So you see the spaces which are filled with the lymphatic fluid, and these are lined by the lymphocytes. In between these sinuses you see the lymphocytes aggregations in the form of the cords here. These are called the medullary cords, and these sinuses, lymphoid sinuses, are called the medullary sinuses. And from the center you see one efferent vessel, a lymphatic vessel. So the lymph node consists of, receives lymph from the different channels, many afferents, but from each lymph node one vessel comes out, that is the efferent lymphatic channel, and so this comes out from the hilum of the lymph node. So that is the structure of the lymph node. So in nutshell, the lymph node consists of the outer cortex and the inner medulla. It is covered by a capsule. Beneath the capsule you see the subcapsular sinus. So you see number of trabeculae extending from the capsule. So along these trabeculae you see the trabecular sinus extend from the capsule into the parenchyma of the lymph node. And then cortex consists of lymphoid follicles, and medulla consists of medullary cords and the medullary sinuses. That is the structure of the lymph node, right? Now we'll see the tonsil. So before going to the tonsil, first we'll finish off the structures with the lymphoid follicle structure. So tonsil comes under the mucosa associated lymphoid tissue. So it comes under the malt, and in the malt it comes under the galled category. So mucosa associated lymphoid tissue. You see diffuse lymphoid follicles beneath the mucous membrane. So any tonsil, this is the palatine tonsil. So because it is palatine tonsil, it is covered by the surface, it is lined by the stratified squamous non-keratinized epithelium. This is the stratified squamous non-keratinized epithelium because it is the oral mucosa. So entire oral mucosa is lined by the stratified squamous non-keratinized epithelium, and you see the crypts. So in the tonsil, palatine tonsil, you see the tonsillar crypts. So this is the intratonsillar crypt. This is one of the crypt. And the typical structure of the tonsil is one side it is towards the mucosa side, oral side, it is lined by the mucosa, stratified squamous non-keratinized epithelium, and the other side of that towards the pharyngeal side it is covered by the capsule. So one side it is covered by the capsule, the other side it is covered by the mucous membrane. And how to identify the stratified squamous epithelium? So always if you look at the basement membrane, it is folded. You see the folds in the basement membrane. That is the typical structure for any stratified squamous epithelium, that is the basement membrane. And you see the multiple layers. You know how to identify the stratified squamous epithelium. Then beneath this you see the lamina propria here, and then beneath that, within the lamina propria, you see the collection of the lymphoid follicles. This is one lymphoid follicle and this is the other lymphoid follicle. You see number of lymphoid follicles beneath the lamina propria. And then the outer surface is covered by the capsule, and sometimes you may see the mucous acini, serous acini, and some blood vessels. So all these structures you see in beneath this lamina propria. So it is mucous membrane is lined by the non-keratinized stratified squamous epithelium. Then consists of tonsillar crypts. One of it is large and it is called the intratonsillar crypt. And lamina propria consists of the lymphatic nodule. Sometimes you may see the mucous acini, and outer surface is covered by the capsule. So these are the salient features, that identification points to be written in the exam. And then so how to identify the tonsil slide? So whenever you see in the microscope, you see the aggregation of lymphocytes as the lymphoid follicles, and you see the stratified squamous epithelium, then it is the slide of tonsil, right? Then before the thymus, we'll see the other lymphoid structure with the lymphoid follicles. It is the spleen. Spleen, it consists of a capsule, so it is lined by the capsule. It's not seen in this slide, so it is the capsule. So wherever you see the capsule, it is consists of the collagen fibers, and then beneath the capsule you see the extending from the capsule into the parenchyma of the spleen. You see number of collagen bundles which are extending as the septa. These are called the trabeculae. So this is one trabeculae. You can see here nicely the trabeculae. Here is another trabeculae. So number of connective tissue septa will extend into the spleen parenchyma from the capsule. These are called the trabeculae. And then when you see the parenchyma of the spleen, you see here number of lymphoid follicles. This is one lymphoid follicle, this is the other lymphoid follicle, and this is the other lymphoid follicle. So you see number of lymphoid follicles. So these lymphoid follicles we call it as the white pulp. And then in between the lymphoid follicles you see number of sinusoids. These are all the sinusoids. The spaces which you are seeing are the sinusoids filled with the blood. And then in between the sinusoids you can see here the cords of lymphocytes here. These lymphocytes are called the cords of Billroth. So these lymphoid aggregations that you see in the red pulp, they are called the cords of Billroth. So red pulp consists of the sinusoids filled with the blood and the cords of Billroth. Cords of Billroth are nothing but the lymphoid aggregations along the walls of the sinusoids. Then, so why we call it as red pulp and white pulp? When we cut the fresh specimen of the spleen and look macroscopically, in that you see some white spots and rest of the spleen will look reddish and bloody. So these white spots we call it as when we fix the spleen and fix it under and then see under the microscope, these white spots which appeared in macroscopically will be the lymphoid aggregations. So these are the lymphoid aggregations that you see. So that's why these lymphoid aggregations are called the white pulp. Those white spots we call it macroscopically as the white pulp, and rest of that is reddish and that we call it as the red pulp. So when we look under the microscope, the red pulp will look like this and the white pulp will look like this. So the speciality, how to identify the lymphoid follicle of a spleen and the lymph node. Wherever, so when you see the lymphoid aggregations, we call it as the lymphoid follicle. So here the speciality of the splenic lymphoid follicle is the eccentrically placed arteriole. So you can see this is the eccentrically placed arteriole. So whenever you see a lymphoid follicle in the spleen, when you see an eccentrically placed arteriole in each follicle, then it is the identification feature for the spleen. Here I focus 3 lymphoid follicles in this slide. All the 3 have the eccentrically placed arteriole. Here is the arteriole. Here is the arteriole. Right? This is the lymphoid follicle and this is the arteriole. This is the lymphoid follicle. This is the arteriole. This is the arteriole. So lymphatic nodule with eccentric arteriole is the characteristic feature for identification of the spleen. So whenever you are given the slide spleen, you are not supposed to write cortex and medulla. So the moment we see the cortex and medulla, that shows that you don't have any knowledge regarding that slide. Even if you draw the correct diagram and name it cortex and medulla, you will get 0 marks. Right? Cortex and medulla, you use this terminology only for 2 slides, lymph node and thymus, not for the other slides. Okay? And for the spleen, you have red pulp and white pulp. In the white pulp, so you need to identify, these are also called the Malpighian corpuscles or the Malpighian bodies. So this white pulp consists of the lymphoid follicles with an eccentric arteriole. Truly speaking, it is not an eccentric arteriole. To start with, initially there will be a blood vessel, an arteriole. Around this arteriole, you see the formation of the lymphoid follicle, aggregation of lymphocytes along this arteriole. But once you see the formation of the germinal center, so this arteriole is pushed to one side. So you see here, here you see the formation of germinal center, and this arteriole is pushed to one side because of the appearance of germinal center. That's how the central arteriole will become eccentric. The name is the central arteriole, but because of this formation of the germinal center, it will be pushed to the eccentric position. Okay, so it is an central arteriole which is surrounded by the lymphoid tissue, but under the sections it appears as the eccentrically placed. That is the red pulp and white pulp. So for the spleen structure, it consists of the capsule and the connective tissue extending into the parenchyma. We call it as the trabeculae, and it consists of red pulp and white pulp. Red pulp consists of, this is the red pulp, consists of the sinusoids and cords of Billroth. Cords of Billroth are nothing but along the sinusoids you see the aggregation of the lymphocytes as cords, and those are called the cords of Billroth. And white pulp consists of lymphoid follicles or Malpighian bodies with an eccentric arteriole. Eccentric arteriole is the characteristic feature for the identification of the spleen slide. Clear? Now we will see the last slide of this category, the lymphoid tissue. It is the thymus. Thymus, as I said earlier, it is the identification feature for the thymus. When you see the lymphoid tissue under the microscope, when you are not seeing any lymphoid follicle, then it is the slide of thymus. So clear. So for other 3 slides, you see clear-cut lymphoid follicles. For the thymus slide, you don't see the lymphoid follicles. It is, if it is a, how to identify that it is a lymphoid tissue, you see numerous lymphocytes. Entire slide is with the lymphocytes. When you see number of lymphocytes, but there is no formation of the lymphoid follicle, you can identify it as the thymus. Right? It's a very easy slide to identify, but in examination, many students fail to identify the thymus. Right? Then, thymus is covered by a capsule, and this, from the capsule you see number of septa extending into the parenchyma of the thymus, and these are incomplete septa. That means this is the capsule, and you see number of septa which are extending into the capsule, but these will not extend into the medulla. So another thing that you should remember for the thymus or the cortex and medulla. So this outer part of each lobule, so this is one lobule of the thymus. So this outer part of this lobule is called the cortex, and the central portion of this is called the medulla. So here this medulla will extend into the each lobules. So the central part is called and the central part is communicating with the other lobules here. So the central part, so this part we will call it as the medulla, and the peripheral part of this is called the cortex. And in the cortex you see the compactly arranged lymphocytes, and in the medulla, that is in the central portion of each lobule, we call this consists of the sparsely distributed lymphocytes. But in the periphery, though it is little compactly arranged lymphocytes, you don't see any formation of the lymphoid follicles. Right? So the lymphocytes will never aggregate as the follicles in the thymus. And then, so here also you can see number of septa. This is one septa, this is the other septa, which are extending into the here also you can see one septum here that is extending. So you can see two distinct lobules here, and you can see the continuation of the medulla into the two lobules. And the other feature for the thymus is all other lymphoid tissues, the supporting network are the reticular fibers. You see the reticular fibers, but you don't see on the low power microscopes. Unless you use the special stains, you can't see the reticular fibers. But for the thymus, the supporting network is the epithelial cells. So these are called the epithelioid cells or the epithelial cells. These are thymic epithelial cells, and these lymphocytes here we call it as the thymocytes, and within these thymus you see number of epithelial cells forming the network, which within this network of epithelial cells you see the presence of the lymphocytes here. So this consists of the capsule, multiple incomplete septa extending into the parenchyma, dividing the gland into incomplete lobules, and each lobule consists of darkly stained outer cortex and pale stained inner medulla. Because it is pale, why it is pale stained? It consists of less number of lymphocytes, but outer cortex consists of densely packed lymphocytes. And other characteristic feature, identification feature for the thymus is the presence of the Husserl's corpuscles. What are these Husserl's corpuscles? These Husserl's corpuscles are also called the epithelial pearls. So you can see here the coral shaped eosinophilic structures here. You can see here. These are all the Husserl's corpuscles here. So what are these Husserl's corpuscles? These are degenerated epithelial cells in the thymus. So these degenerated epithelial cells will be forming the coral-like eosinophilic bodies, and these are called the epithelial pearls or the Husserl's corpuscles. So when the thymus is, as the age increases, the Husserl's corpuscles number also will increase. So that is the identification points for the thymus. So if thymus is having, it is a capsulated structure, and it is a primary lymphoid organ or the tissue, and it consists of the outer cortex and the inner medulla, and each lobule is, you see from the capsule number of septa extending which are incomplete, and the medulla of each lobule is continuous with the other one, and the cortex can be differentiated by means of the darkly stained cells which are compactly arranged. Medulla can be identified, which is the pale stained and sparsely arranged lymphocytes, and in the medulla you see the eosinophilic bodies, which are the coral eosinophilic bodies. Those are called the Husserl's corpuscles or the epithelial pearls. So when you see a slide without the lymphoid follicles or lymphoid follicles or lymphatic nodules and diffusely arranged lymphocytes with central Husserl's corpuscles, that is the slide of thymus. Clear? So now we have discussed 4 slides in the lymphoid tissue: the lymph node, palatine tonsil, spleen. These 3 slides can be identified with the presence of the lymphoid follicles, and the thymus without lymphoid follicular arrangement. And for the lymph node, you have the cortex and medulla, and its structure is distinct. The lymphoid follicle of the lymph node and the spleen you can differentiate. In the spleen, you can see the eccentric arteriole placed arteriole. You call it as the red pulp and white pulp. For the lymphoid follicle, you call it as the cortex and medulla, and in the lymphoid follicles, you don't see any arterioles. That is the characteristic feature to identify the lymph node and the spleen. And then palatine tonsil you can easily identify whenever you see the stratified squamous non-keratinized epithelium, and beneath the epithelium you see the aggregation of lymphoid follicles. That is the slide of palatine tonsil. No confusion in identifying these 4 slides. Now we will move on to the glands. So in the glands category, so you have basically the glands, you know the different types of glands. I am not going into the theoretical aspects of the glands. You have unicellular glands, multicellular glands. Unicellular glands, example for unicellular gland is the goblet cells, and in the multicellular glands, so when the cells are forming a tissue or a structure, then with number of cells, similar function, performing the similar function, then we call them as the multicellular. So then that is so in each gland, so these glands are basically divided into the exocrine glands, and that is another classification, exocrine and the endocrine glands. Exocrine glands are means the secretions of the glands are poured into a duct. All these secretions are collected by means of a duct, and they will reach the target organ structure. So that is the exocrine gland, and these are also called the duct glands and ductless glands. Endocrine glands means they don't have any ducts, they will secrete their secretions directly into the bloodstream, that is the capillaries. So that is the endocrine glands. So you have exocrine glands and the endocrine glands. So I am not going into the endocrine glands at this level. And the exocrine glands you have, based on their duct and the secretory units, so we call them as the tubular glands, simple tubular glands, and then compound glands, and then within that branched glands, simple glands. So in the simple tubular glands, example is the uterine glands are the simple tubular glands, and the other glands. So these are branched ones. Number of branches will be there for the ducts, and then all these will be joined and form the main duct. So small ducts will join to form the main duct. And then depending on the structural unit, this will be the acinar, tubuloacinar, and then you have the acinar glands, where you see the structure will be forming like an acinus. And from the acinus, a duct will come, and these secretions will be going into the acinar. And then you have the wide space, so this will form a sinus. So here alveoli, so these are not sinus, alveoli. So wide one is tubulo-alveolar glands. So tubulo-alveolar glands, example for the tubulo-alveolar one is the mammary gland. So that we will discuss later. And now we are discussing in the glands, the salivary glands. These are the acinar glands, right? So these will have the acini, right? So that's the tubuloacinar, tubuloalveolar, and mixed of these two acini and the alveolar types. So that is one category of the glands. Classification of different types of glands: unicellular, multicellular, exocrine, endocrine, tubular glands, branched glands, and then tubulo. In the branched ones, again you have the acinar and then the alveolar types of glands, right? That is the basic classification of the glands. We are now discussing the salivary glands. In the salivary glands, you have three types of salivary glands depending on the secretions. So depending on their secretions, so these are divided into serous salivary gland, mixed salivary gland, and the mucous salivary gland. Serous salivary gland, where you see the serous fluid, and these acini are also having a different structure. Serous salivary gland, example for the serous salivary gland is the parotid gland. Another type of serous gland that you see in the GIT is the pancreas. Though it is not salivary gland, I am describing this pancreas here because so you need to differentiate a serous salivary gland from the pancreas. So pancreas is a exoendocrine gland. It is having both the exocrine component as well as the endocrine component. In the exocrine part of the pancreas looks like the serous gland because it secretes the serous kind of fluid. And then mixed gland means mixed salivary gland. It is having both the serous acini and the mucous acini. Its secretion is both serous and the mucous fluid. So hence it is called the mixed salivary gland. Example for the mixed salivary gland is the submandibular gland. Even in the exams, if you see the serous gland, if you write parotid gland, it's okay. We will give you marks. So even the mixed salivary gland you can write as the submandibular gland. And then the mucous gland, so where you see it is purely the predominantly mucous acini. So you see mucous acini, example for the mucous gland is the sublingual gland. So you have three types of salivary glands, the serous, mixed and the mucous. And in the serous gland, example is the parotid gland, mixed, submandibular gland, mucous gland is the sublingual. So it is not purely serous, it is predominantly serous, it is not purely mucous, predominantly mucous. And mixed one is the submandibular gland. And pancreas is also included in this category of slides. So its exocrine part will resemble the serous salivary gland. Pancreas you can identify by means that in between the serous acini you see the islets of Langerhans, that is the endocrine part of the pancreas. So that we will discuss later. So this is the serous salivary gland. So we focus this under the 10x, this is the 10x magnification. So here you can see the parenchyma consists of, it is covered by a capsule. From the capsule you see the number of septa extending into the gland, dividing this into number of lobules. And so here you can see this is one septum. So this is all one septum that is extending here. This is another septum which is extending here. And here you can see the septum here. So within these interlobular septa and intralobular septa, so you see the presence of the ducts. So these large structures which you are seeing, these are not the acini, these are the ducts. So here another duct, this is another duct. So you see number of ducts, this is also a duct, small duct. So ducts you see here, number of ducts which are lined by the, this is either simple cuboidal epithelium or a stratified cuboidal epithelium. You can see this is the stratified cuboidal epithelium. How you identify the cuboidal, the stratified epithelium? By means of their nuclei, number of nuclei. Here you see two layers of nuclei. This is a stratified cuboidal. This is a simple duct here. Here is also, it is a simple duct, intralobular duct. And these interlobular ducts will join to form the interlobular ducts, and these will join the main pancreatic duct. Sorry, main salivary duct here. And then how to identify these acini? So this is one acinus. This is one acinus, serous acinus. So because I told you it is a predominantly serous, we don't call it as a purely serous gland for humans. It is the, and even for the serous salivary gland, sometimes you may see some mucous acini also. Here and there you may see mucous acini and the serous demilune. So here you can see one mucous acinus with small serous demilunes here. And here also, here and there. So here also you see some mucous acini. Here also you see some mucous acini. Here and there you see some mucous acini. And but predominantly you see these are all the serous acini. Predominantly serous acini, that is the parotid gland. How to identify an acinus? So in the serous acinus, serous acinus, the cells will be pyramidal shape. The cells will be pyramidal shape with a broad base, and lumen will be very small, and these will be having a rounded nucleus. You see a rounded nucleus like this. That is and this will be darkly stained. So you see the granules here. So that is the structure of a serous acinus. The cells will be pyramidal. If you look under the high magnification, you can see them. And lumen is not very clear. So you can see here very small lumen, and the cells will be having the rounded nucleus. That is the structure of the serous acini. And the more or less it is similar. The pattern of the parenchymal pattern will be, structure will be similar for all the three glands. There is all of them are covered by the capsule, and then the connective tissue septa, interlobular connective tissue septa, intralobular ducts system in all will be same. So I need not go again and again for all the three slides. Only identification points for this is, you see the serous acini lined by the pyramidal cells and with a round centrally placed nuclei. So that is the characteristic feature for the serous salivary gland. And for the pancreas, so here this is the pancreas. This is not very good slide. The preparation is not good, but you have this slide only. And here you see these are all these blue structures which you are seeing are all the serous acini here, and in between the serous acini. So you see the connective tissue is very minimal for the pancreas. For the salivary glands you see lot of connective tissue, but for the pancreas you don't see the connective tissue. The literal meaning of pancreas is pancreas. Pan means all, creas means flesh. All flesh. It is very soft structure, and you don't see much connective tissue for the pancreas. That is the, and then you see here this is one connective tissue septum that is extending, and where you see the interlobular connective tissue septa with some ducts, and these are the blood vessels. This is a blood vessel. And you see here within the parenchyma of the gland, you see the serous acini, and the lumen is almost not seen for the serous acini of the pancreas. But here you can see the serous acini, small lumen you can see, clear lumen. For all acini you can see at least a small space in the center. Are able to see here, this is a small lumen that you can see here. But for the acini of pancreas you don't see the lumen, because in the center of that lumen also you see the cells. That means here if it is the acinus, and for the others it will continue with a duct like this, but for the pancreas, that is the acinus, the duct will go little inside and then start its duct. Little protrusion of the duct will be inside, because so there is no chance to spill any of the fluid to leak the fluid to outside, because it consists of the digestive juices. They are not supposed to leak. So this part of the duct, intercalated duct here, so consists of this, because it is little projected into the acinus. When we take the section, the lining epithelium of this duct will come into the, as it appears as if the cells are present within the center of the acinus. So if you see the acinus, we see the pyramidal shaped cells here, the seed and the serous cells, and in the center also we see a cell here. Here in the center also we see a cell. So this is the nucleus for these cells. So you see the nucleus, rounded nucleus, but in the center also we see the nucleus. You don't see the lumen at all, because the cell of this duct will come in the center, and these cells are called the centroacinar cells. That is the characteristic feature for the acini of the pancreas. You see darkly stained serous acini with a narrow lumen and the centroacinar cells in the lumen. So in the lumen, so it appears that there are nuclei, but they are not present in the lumen, but the protruded part of this duct, intercalated duct, will give rise to that nucleus, which are called the centroacinar cells. And then serous acini are lined by the pyramidal cells with round centrally placed nucleus, and you see the islets of Langerhans. So in the islets of Langerhans, so you see number of capillaries, sinusoids here, and surrounding these you see the alpha cells and the beta cells, which will secrete the glucagon and the insulin. So these are the where you see the islets of pale stained nucleus which are not capsulated, and these are called the islets of Langerhans, which is the endocrine part of the pancreas. Pancreas is an exoendocrine gland which is having exocrine part and the endocrine part. Clear? That's how you need to identify the pancreas. So here the acini consists of the centroacinar cells. That is the characteristic feature, and you also see the islets of Langerhans for the pancreas, and you see minimal connective tissue in the parenchyma of the pancreas. These are the identification points for the pancreas slide. Then you have the mixed salivary gland. So how to identify the mixed salivary gland? So in the mixed salivary glands, you have both the serous acini as well as the mucous acini. Example for the mixed salivary gland is the submandibular gland, and the structure is similar to the other glands, salivary glands. It consists of the capsule and then the interlobular connective tissue septa. This is an example for the interlobular connective tissue septa. This is a blood vessel here. And you can see the duct in the interlobular connective tissue septa, interlobular duct. It is a stratified cuboidal epithelium here. And you can see here, these are the serous acini. This is one serous acinus. And you can see number of serous acini. These are the serous acini. You can see this is the serous acinus. Here you see bunch of serous acini here. These are all the serous acini and the mucous acini. So you see number of mucous acini. So how to identify the mucous acini? So the mucous acini will be larger ones. These will be lined by the columnar cells. These will be lined by the columnar cells. Tall columnar cells. Like this you see, and the lumen will be large. For this, the lumen will be large, and because it is filled with, these cells are filled with the mucus, the nucleus will be flat and towards the base. The nucleus is not very rounded, it is flat and towards the base like this. That's how you can identify the mucous acini. So, and it appears pale because during the preparation of the slide, the mucus will be removed. So, that's why you don't see the mucus here in this, and appears, and it is not stained with the eosinophil methoxylin. So, it will appear like a pale structure. You can see here nicely the lumen of this acinus, and you can see the nuclei which are placed towards the base and flattened. That is the mucous acinus. And the characteristic feature for the mixed glands is the presence of the serous demilunes. What are the serous demilunes? Serous demilunes is the characteristic feature for the identification of the mixed gland. So here I show you one serous demilune here. This is the mucous acinus, and over this mucous acinus you see a cap of serous cells here. These are the serous cells, and this is the mucous acinus, right? This is the typical example that you can see for a serous demilune. Here also you can see here serous demilune. This is the mucous acinus here, and over this you see the serous cells. This is an example for the serous demilune. Here also the mucous acinus here, and over this you see the serous cells here. So how the serous demilune, these are the mucous acinus, over that you see a cap of mucous cells, serous cells here, which are eosinophilic and with rounded nucleus. You see the rounded nucleus over these. These are the serous demilunes. So the characteristic feature for the mixed gland is presence of the serous demilunes. You see mucous acini, serous acini, and the serous demilunes. So here you can see the serous acini, here you can see the mucous acini, and in between you can see the mucous acini. Here also you can see nice mucous acinus with a large lumen, and it is covered by a serous demilune here. This is the serous demilune. This is little higher magnification to show you how you can identify the serous demilunes. No confusion, right? So that is a mixed salivary gland. So you see the lightly stained mucous acini with a large lumen, and then darkly stained serous acini with the narrow lumen, and you see the serous demilunes. That's the mixed gland. And for the mucous gland, this is the mucous salivary gland. Example for this predominantly mucous, and example is the sublingual gland. Here you can see large mucous acini. These are all the large mucous acini with flattened nuclei, tall columnar cells, large lumen. These are all the mucous cells here with flattened nucleus towards the periphery, and you see the interlobular connective tissue with a duct, septa with the large duct here, one of the large duct here. And then you don't see much serous acini. Occasionally you may see the serous acini. So here you can see one serous acinus, here one serous. Occasionally here and there you may see the serous acini, and this is one intralobular duct. This is a duct which is lined by the simple cuboidal epithelium. You can see little larger lumen with the cuboidal cell surrounding it. This is an intralobular duct. This is an interlobular duct, and interlobular connective tissue septa with a large duct here. So these are the mucus acini. You can easily identify the slide of the mucus gland and the slide of the serous gland. Only thing, when you see the slide of the serous gland, you need to differentiate it from the pancreas. So pancreas, how can you differentiate it from the pancreas? Pancreas, the serous acini, so you don't see the lumen. Even in the lumen you see the centroacina cells and you see the islets of Langerhans. But for the serous salivary gland, you see the ducts, intralobular ducts, interlobular ducts. This is an interlobular connective tissue septum, and now numerous connective tissue here. But for the pancreas, we don't see much connective tissue, and you see the islets of Langerhans. And serous acini of the pancreas are different from the serous acini of the salivary gland. And then the mixed salivary gland you can identify by means that it consists of both the serous acini, mucous acini, and the serous demilums. And for the mucous salivary gland, you have the mucous acini. That mucous acini you can identify by means that these are the large acini with columnar cells and the flattened nucleus which is pushed towards the periphery. Why mucus is not seen under eosin and hematoxylin slides? Because it will be removed during the slide preparation, as well as it is not stained. Mucus is not stained with the eosin and hematoxylin stains. So if you want to see the mucus, you need to use the special stains, right? So that completes these slides of the glands. Next class we will see the connective tissue. The connective tissue, you have the cartilage and the bone, as well as connective tissue. Then we'll see the muscle, nerve fiber in the next class, right? So that completes the general histology slides. Thank you. And one more announcement for you. All of you prepare your records up to date. Complete your records, gross anatomy as well as the histology records. Whenever the college is reopened, on the first day of the reopen itself, first or second is within a week time, you are supposed to submit your gross anatomy and the histology records. So kindly complete your gross anatomy and histology records before you come to college. So I don't know when the college is going to reopen, but by the time college is reopened in the September or October, you are supposed to submit your records. Okay.